Let me tell you, I spend 6 hours a day with American doctors from 12 to 6 a.m. every day. I have so many calls with American doctors, and I have to call one after the other. And every day I will have at least 10 to 15 Zooms and WOMs with China. It's non-stop. Even today, after this lecture, I will still have a lot of other commitments. Okay, it is full every day. We have to plan every week, but it's fine. And everyone will say, Mike, you're so busy. I'm sure you will not answer my question. No, I will answer every question. I have 1,000 email and WhatsApp a day. I answer all of them, unless I miss it out. Sometimes I miss out. Okay, I try not to miss out. Okay, we will treat immediately because the younger you treat the child, the better it is. Please bear in mind, the brain is developing. The speed of developing of the brain to 4 years old go at a very fast speed. The baby out from the mother and going out to 4 years old to 5 years old is the fastest rate of development. Then it goes a bit slower and it goes on until 20 years old. Okay, some of the cells will be fully developed, but only part of the cell not fully developed is the frontal lobe at 25. So when we treat the autistic children, we used to treat a lot of them age 4 and 5. And I love to treat them at age 4 and 5. And in the case of Down syndrome children or cerebral palsy children, you can treat them as young as 6 weeks old. We have been treating a lot of Down syndrome children as young as 6 weeks old. Because for autistic children, at 6 weeks old, you don't know that they are autistic. So for that reason, no patient will come to us at that age. Okay? So there's no problem for that. GcMAF, we do not encourage GcMAF to be for 3 years, is it? No, for 3 years, no, it's too young. Okay, I would not encourage GcMAF, but we have other solution. Not necessarily you must give GcMAF. GcMAF is given, there's a lot of study and even through our own experience, given not for cancer patient alone, also for prevention of cancer and also for autistic children. Okay, there's a lot of studies. Even ourselves, we have a number of studies on GcMAF, but also on cancer patient. But too young, there's other solution to give. Okay, the rest is fine. But anyway, our GcMAF is still organic. It's coming from the first drop of the cow's milk of the pregnant mother for the first time we took the first drop of the milk. Okay, the active ingredients. Okay, a patient of 17 years old with ASD, of course. Remember, you see the picture, that guy is 20 years old. We had treated a lady of 26 years old. The mother spent her across the world to be treated. And she was from Labuan, and then she came and we treated her very well. And she was 26 when we treated her. She's a lady. Okay, we have so many patients. We have also a lot in the 17 and 18 in Malacca in the old days. We still have, we treat them because there was a Kana Association of Autistic Children there. Been treating a lot together with Dr. Yi, and we're providing a lot of good solutions. And across the world, we have in the Middle East, where we go to the Middle East almost every month. Our German and European doctors were flown down to treat a lot of patients in the Middle East in the old days. Okay, so the experience of even cerebral palsy children from the Middle East to Malaysia or to other parts of the world, or even in Thailand or even in Hong Kong, we have a lot of Taiwanese patients in the past who go to Hong Kong for treatment. It has been ongoing all along. I have been treating a lot of children from Suzhou 小孩医院. 小孩 means children hospital. The hospital, it has thousands and thousands of children. It's a whole big hospital there. And they sent a lot of patients at that time in the early 2000s to Hong Kong. Okay. Where can I send my patient to the nearest center? I'm currently in KL. They can come to KL. They can be treated in KL. They can be treated in KL. They can be treated in KK. Okay, they can even be treated by the doctors themselves. We will guide the doctors. Now, some of you are doctors here. We will guide you how to treat the patient. I just have patients from different parts of the world. We can still arrange the stem cells or the cells to be delivered to all parts of the world. We've been shipping a lot of cells to all parts of the world. It's not a problem. Okay, so for Malaysia, it's nothing. We have a very big team of European doctors in Malaysia. Even in KK, we have 7 European doctors. We are not talking about our local doctors or researchers who are also PhD or doctors. So there's a lot. We have a big team of even PhD and masters in science, about 20 of them in Kota Kinabalu. We have a big lab in Kota Kinabalu. We are building a 4-story lab solely for research and testing. Of course, it's not just in Malaysia. We are building labs all over the world. Okay, it's not only in Malaysia. I mean, apart from our labs in Europe, we are building labs all over the world. So most of my clients have issue with skin disorder such as psoriasis and eczema, acute dermatitis. Ask any dermatologist. There is no cure for condition like this. Okay, because this is an autoimmune problem. The only cure you can do is they will give all the steroids. We do not want that. And that is not even a cure. That is only to control the flare-up, you know. So what we want to do here is autoimmune. So obviously you have to go by the autoimmune way. Remember I was mentioning the ASI therapy? I have to take the Buffy coat from the serum on the 4th day. It cannot be centrifuge. We have the natural formation of the Buffy coat because that Buffy coat will contain the DNA of the immune system, and then it had to be sent to our lab. We have to process it and we will activate it, and we create a vaccine out of this Buffy coat of that patient. The immune system of all us will have problem with autoimmune setting in as we age. So your immune system is changing all the time. So we have to take the blood at that time, you know, and it has to be done. And then we create 30 wires to be injected over 60 days. Okay, just like a diabetic needle, 30 gauge needles, you know, very small needles. The patient can inject on himself, or the parents can inject on the child, on the abdominal area. Okay, it can be easily done without any much hassle, just like a diabetic patient. Okay, so that is a solution. Of course, again, because of the skin problem, okay, I will tell you my own child story. My eldest son was born with asthma, very chronic asthma. Okay, he walked into a place with an aircon room or drink a glass of cold water, he'll be hospitalized. It's very chronic. So he spent a lot of time in hospital those days. Okay, and I went to all the best dermatologists in the world. I sent my son flying European doctor, American doctors down to Kota Kinabalu and treat my son, because he was having such a chronic eczema patient that he was the Chinese boy who become Indian boy. Can you imagine he is a Chinese boy with a skin fairer than me, and he become much darker, just like an Indian boy, without hair and eyebrow. He lose all the hair because he's itching and he's scratching. Even the beloved grandmother will not sleep in the same hotel room with him. The grandmother who bathed him as a baby and stay with him all the time. But when he rise up from the bed, all the flecks of the skin is flying around like it's snowing in the air. It's a very chronic decision. Okay, he's sleeping with his 2 hands with the fingernails he don't want to cut to scratch, and it's full of blood on the bed sheet. The bed sheet has to be changed every day, and we have to vacuum every day. I have changed many maids just to take care of him. The maids do not want to work, even with a high salary. So this is my suffering story of my own son, where I never tell to many people for many years. And my son has to be covered totally with his head mask or whatever you call it. You know, he's wearing something cold, and he will cover his hand, everything to school. He started to have eczema with just a 50-cent coin on the head when he was standard 6 on the standard 6 holiday. And he went on because I was traveling. By the time I traveled and come back with my Michelle, my wife, because I travel every week all over Europe and the world. It progressed so fast within the 3 months. And eventually the whole hair, the whole face, everything. When I touched and put cream on his so dry, when I touched his back, I scratched my palm. Can you imagine how scratched? The knuckles is more than, everyone is like a 50 cent on my knuckles, sharpening, and it's like hills and mountains. I have never seen anyone in a dermatology problem like my own son. I consulted all the top dermatologists of the world, and they can come up with all the other treatments they can think of. They couldn't do anything. Then I thought of my own master. Okay, it was so painful for my son. He was removed from school 3 times in a private school because the people will create a situation to take him out from school. And each time I went to see the headmaster, why you remove my son, the headmaster will look at my wife and myself. I will be in a short pant. He looked at my legs, looked at my hands. He thought my son is suffering from sexual disease. You know, and they are thinking of situation to remove him. It's not infectious, but the parents of the children will get afraid. So I always remember my son is exactly like the movie, What I Know What You Did Last Summer. You cover everything and no one see your face, even wear dark glasses. Can you imagine a school allow you to wear dark glasses, okay, and cover everything? That means you're not on uniform and the school allow that. That means they do not want you to show also. He have never wear a short sleeve. Only recently he wear short sleeve of last few years, okay? All the while he never wear short sleeve. He cover everything. Even his leg is like an elephant leg. That means it's all black. This is my condition of my own son. So after finding all the solution, without any solution, I watched a movie called Lorenzo Oil in the old days when I was a child. My father brought me to show about this picture of a rare disease of a child and the mother go to extremities to cure her own son. It was the same situation for me and my wife. Okay, and we sometimes feel a bit embarrassed when people is looking at our son. Okay, when I brought my son to the office, all my office staff will look at my son as if he's having something and he couldn't be my son, you know. And many years later, when my son came to the office, everyone's eyes was wide open looking at my son. It's your own son. Can you imagine how bad it is? And people will say, oh, you are one of the authority in stem cells, you know. How come your son like that? But they don't understand it's an autoimmune problem. You cannot use stem cells alone for autoimmune. It won't help. We try mesenchymal cell, we try all kinds of cells. It won't work. Okay. So with the ASI therapy, I remember my mentor, my teacher, a cell therapist, did this therapy. It was patented in Germany in the old days. I learned from him. I recall back, he used it to treat autoimmune disease. Because my master had died at the age of 90 plus, I've forgotten about that therapy. So we start back that therapy and I studied on my own son. It worked so well. With one treatment, he recovered. Okay, and he continued to recover. Today, he's on short pants and t-shirt without collar. He can show his face. Okay, those days, you cannot even find one hair on his fat body because eyebrow is gone, mustache is gone, hair is gone, everything is gone. He looked very alien. This is my sad story, my enduring story to tell to you. Okay, so there is a solution. What did I did? We did the ASI. We did give him the mesenchyme. We give him the super transfer factors a lot. We give him the thymus. That's all we give him until today. Nothing else. Okay. Every time we go any parts of the world, even on a ferry or in a car with aircon, he probably will land up in the hospital. Okay. So I spend a lot of time in the hospital looking after my son. Okay. Even on vacation, he'll be in the hospital and the whole family had to leave and I have to stay back with my son. Okay. So that is something I like to tell you. There is a solution. It's a matter of finding it. Now, there came another story after my son. I have a husky dog. You know, husky are very thick fur dogs. It's a white husky dog. My young son, of course, you love your son. So my son went to the dog. He wanted to buy a dog. I said, okay, I bring you. He go and buy a husky dog. And my wife said, no. For husky dog, the dog, this is a hot climate, you know. You cannot have a dog like this. But my son told me one thing, if you don't buy for me, I would feel very sad. That word hurt me very much. I went back to buy the husky dog against the decision of my wife. Okay. And true enough, a few months later, the dog started to scratch the head. Eventually, the dog had to wear a mask. And eventually, the white dog became a red dog. Bleeding dog. Bleed is a red dog from far. You don't see a white dog anymore. The dog was suffering and bleeding so much, okay, scratching to the extent I have to hospitalize the dog for 1 year in the vet clinic. And the vet doctor keep calling me many times when I'm traveling. I have to put your dog to sleep. I say, no, there's no way you can put a life to sleep. It is my dog. You have no right to do that. I have spent $60,000 treating the dog with steroid. The vet doctor spent, okay, with all the new steroid for dogs. And he said he had no solution. So one day he said, you don't come, I will still kill the dog because all my customer is running away. Because I also have other dogs in the vet. You know, the other dogs look at this dog, they are running away because he's even having bacteria. So one day before Chinese New Year, 2 days before Chinese, I went to see the dog. When I went to see the dog, I looked at the dog. The dog cannot even wag the tail. The eyes just look at me, watery eye, and he's not wagging any tails at all. He used to wag around, okay? It was so saddening that I feel like killing the dog myself, injecting him and putting him back to sleep. But I put on a last hope. The last hope was remembering my son has the same kind of dermatological situation like this dog, okay? So I thought of the same situation. I took the dog's blood and prepared the ASI and sent it back to the vet doctor. And the vet doctor wasn't there at that time. So I told the guy who took care of the assistant and he maintained the dog. So, and it turns out Chinese New Year came by. So the clinic was closed for a long time. The doctor was closed. 15 to 16 days later, I went to see the dog. Okay? My whole family went to see the dog. From far, I hear my dog barking. I couldn't believe that my dog is barking because the first time I see him, he's smelly. He's so smelly that everyone is, thinking it's like corpse, The dog is barking and the dog is alive. And after that, we went on to another, we continued with the therapy and the vet doctor was asking me, what the hell do you give to your dog? Can you tell me the solution? Okay. Of course, I just mentioned about the dog, the solution. I know the dog knows he's injecting. So the dog left the hospital 3 months later, fully recovered, become a white dog again, husky. I was going to move into a bigger house. I spent $200,000 to build an air-conditioned room for my dog. Air-conditioned room, like a room, 100 over square feet. But it's auto glass. He have a field. He can go to the field. It's covered outside the house, but he has an aircon room. The aircon runs on 2 timer. That means 12 hours, because he cannot run 24 hours. And we are going to move the dog to the place, and I was traveling, and unfortunately, the my mate called me and told me a story. He told me that your dog is not eating for 4 days. I said, what's wrong? Why the dog not eating? I don't know. I said, you better bring the vet over. So the vet took over the dog and sent to the vet. And by the time I came back, when I'm going to reach back, the dog called, the vet doctor called me, your dog has died. I said, what happened to my dog? Oh, he has a kidney. I say, do an autopsy. I want to know what happened. He's healthy all the time. So he did an autopsy and they found out that his kidney is damaged. He has a kidney failure. So I cannot understand why he has a kidney failure. So I try to reason with the vet doctor and I go through the list of record of the injection he's taken. They're all steroids. So the vet doctor confirmed with me is that probably the steroid will kill his kidney. So the dog never had a chance to move to his new house. Okay, the whole house, I spent $200,000 just to build an aircon house for him outside, with a nice view, It's around 200 square feet. It's big in my house. It's a bungalow house with a huge amount of land. And that is another touching story to tell. But the dogs went on to live 9 months with quality life with us before he dies off. So from that day onwards, I never have a husky. I still have many dogs in my house. I have 8 dogs, but I never have a husky anymore because that is a sad experience. So there is a lot of things we've been doing a lot on the cats and dogs because they have a lot of skin problems too. Okay, so this is a story we have. There are so many other stories to tell. It can be even written into a books because you have so many experience with different patients, different condition. What is the best therapy for a 70-year-old mid to late stage Alzheimer's patient? No other condition, no other solution. Brain precursor stem cells. You need the precursor stem cells of the brain. It will work well. We are treating an 85 or 86 years old Parkinson patient. Okay, and it works very well. There's a number of old Parkinson patients we have treated, even Huntington disease. So Alzheimer's patient is common because all of us will have Alzheimer's some point in time too. Every one of us will have. If we don't take care of our brain, we will have it. Okay, it comes closer, that's all. Okay, to us. So I would suggest we will need a medical questionnaire to be filled up. Just fill it up. We know a bit of the history of the patient because we need to know what has happened in his past or what's called a medication, what is the current medication or supplements. Okay, then we can come up with a protocol, take the live cells or the precursor stem cells of the brain. But because we also have to give him quality life, so he probably could be a diabetic patient or he could be having other problem, we treat it all together as a whole without the extra cost. When we do the stem cells, it doesn't matter he is a diabetic patient, heart patient, chronic patient, or all kinds of problem. We had to treat everything at the same price of one. Same price of one at one go. When the stem cells are injected, they are injected within 10 minutes on two sides of the gluteal area. We will inject, it won't take us a lot of time. They are deep intramuscular injection of 18-gauge needle for the stem cells because they take fragments of cells. Homing effect will take place within 48 to 72 hours. It will take place within 48 to 72 hours. So it won't take long. There's a lot of proven study on all this. The Halsted principle, I already stated it in 1909. 90 years later, in 1999, Professor Bluber-Gantel won a Nobel Prize talking about cell signaling theory, the same theory. Okay, so all cells will home, but they have to home at the right address. If it's not the right address, they don't home. So if someone would ask me, the placenta cells, where will the placenta cells home? It's a tissue cells. So you don't expect it to home into an organ cells. You will do the stimulation. But a liver cell, where will the liver cell home? Of course, it will home in the liver. It won't home in the heart. Okay? Unless you do an IV, okay, then probably it will go to the lung. Okay? And it was trapped in the lungs. It's not that you do not want to home, it was trapped in the lungs. Okay, so these are the situation, and you won't do the lung any good if you were to give liver cells for the lung. You won't help. Okay, so intramuscular will home. You will home within 48 to 72 hours.